my name is Sarah Smith, and this is my daughter, McKaylee. She's currently 9 years old, and she's the whole reason that we now come as an entire family to Low Country Specific Chiropractic. When McKaylee was about 6 years old, 5 or 6, she was in kindergarten. We were living in Idaho at the time. She started having severe issues with her stomach. She would wake up in the middle of the night screaming, start throwing up, having horrendous diarrhea. And she would have these episodes. At first it was like once a month, and then it was once every 2 weeks, and then it was once a week at least. We started with our regular doctor in Idaho, who started sending us to the emergency room thinking maybe it was appendicitis. And then we started going to specialists at the hospital about an hour away. They did all sorts of different tests. She had nuclear medicine tests done. She had scopes done. She had blood work done. She had numerous things done. They looked to see if her intestines were twisted, if there was an ulcer in her stomach, it was just a whole gamut of things. We tried multiple different medications. We tried different diets. Many things that just weren't helping. She still is a very active girl. At times she was in dance, very active in schools, playing soccer, all kinds of things, and would miss out on different things because of the stomach aches, or because she wasn't sleeping, or because she was throwing up, or different things like that. We moved here to South Carolina with the military, and things were still going, so we started the process all over again. Started seeing a pediatric gastroenterologist here in Charleston. He had her on 3 times the adult dose of Miralax twice a day. And while we did see small improvements, she was still having issues. She still had a distended stomach. She was missing tons of school. They did an upper endoscopy. They did a colonoscopy. They couldn't find anything that was going on with her. And that doctor just said, we had taken almost everything out of her diet. She was on no dairy, nothing with spices, nothing with fat. I ended up having to resign my job at the time. I was a high school math teacher, and because of the amount of time I was having to take to go get her from school because she had a stomach ache, or stay home with her, and then because of her diet that I had to be so strict about what she was eating, when she was eating. She couldn't eat school lunch. I had to pack everything, and everything had to be homemade, so I knew what was in it. So it was just, everything kind of came to a standstill. I quit my job. She was missing tons of school. All of this was going on. The medicine wasn't helping. They had actually, the military they were going to send us down to Savannah. We had a referral to a surgical pediatric gastroenterologist, and at the time what they were figuring out was that part of her intestines were just kind of paralyzed. It was causing blockages, and so in their words, all they had to do was just go in and remove 6 inches of her intestines. It'd be no big deal. She'd only be in the hospital for a week and then have a colostomy bag. And in my mind, I'm thinking, what does a 6-year-old do that's in dance 2 and 3 nights a week with a colostomy bag? Let alone surgery and being in the hospital for a week. That just was unthinkable at the time. And so a friend of mine was seeing Dr. Tron, and she said, why don't you just go in and see Dr. Tron? What's the worst thing that can happen? And I was like, at this point, I'm going to give it a try, especially if it saves us from having to, put my 6-year-old under the knife and have all these issues. So we came in and saw Dr. Tron. He did all the tests. He did the x-rays, looked at everything. She had this distended belly that was always full and agitated. He looked at all of that and realized that she did have quite a severe subluxation that needed to be fixed. Following her first adjustment, she started passing a lot of gas at the time and was using the restroom over and over again, which that was something that she wasn't very regular at all. Her stomach started to drop down. Within a month, she was not having episodes anymore. Since she started seeing Dr. Tron, now it's been almost 2 years, I think. Yeah. We've not had any issues. She uses the restroom regularly. We don't have episodes of throwing up. We haven't had any gastrointestinal issues at all. She eats whatever she wants, whenever she wants. Since starting to see Dr. Tron, she has had perfect attendance at school. She had perfect attendance all last school year. She's had perfect attendance. We're halfway through the school year. This year she's had perfect attendance, and that never happened. I think we've only missed maybe an hour of school for a dentist appointment. That's pretty much it. Also now Dr. Tron, he's our family physician. He sees the entire family. My son Shane, he and I were in a car accident. Dr. Tron saw us immediately after that, and we had no long-term effects from the car accident. He sees my husband, and then most recently my daughter Emmeline, she came and saw Dr. Tron when she was 4 days old and had her first adjustment, which totally helped with nursing. She would only nurse on one side. The other side was kind of a struggle, and it just, now she nurses just fine. So our family, we don't have medical issues. We used to have a box full of medication for sinus issues and gastrointestinal issues and for pain and all that stuff. We don't have that anymore. It's gone. I've thrown it all away. We don't use it. It's just amazing how much healthier and happier our family is. We don't worry about anything because we know that our bodies are working the way that they're supposed to, and we don't have to worry about anything affecting us anymore. We just have fun, right?